Welcome to this exploration of my personal experience of being treated for prostate cancer. What has the process been like, and how do I feel now that the initial convalescence period is coming to an end? So first of all, what was the operation like? Well, I have no idea. I was on the general anaesthetic. All I can tell you is that it was a very structured and caring process of meeting lots of different people, going from room to room. Everyone's super interested in what my date of birth was, and then waking up after several hours, although I have no sense whatsoever of the passage of time, brought down by my lovely anaesthetist Pam, and feeling great, feeling, relieved and really pleased it was done. And yes, they'd given me morphine and it was wonderful. It makes your face itchy. Stayed in the hospital overnight, and then they released me into the tender nursing care of my partner Amy, who did a fantastic job for the next week when my mobility was restricted by being catheterized, which wasn't a lot of fun. It's not my favorite thing. And also just, you're being quite poorly. My abdomen looked like I'd been machine gunned. For the operation, they first of all, they tilt you up at a feet high at an angle so that all of your internal organs go up this way to give them a bit of space to operate in. And then they inject you with, I think, CO2 gas to like inflate your belly to again give the robot fingers more room to delicately move around and perform the surgery, which is controlled by my lovely urologist surgeon Ben. And God knows, it's a modern miracle of science. It's really great. But, it's not inconsequential, so you shouldn't expect too much of yourself in that first week. When it was done, a week later, I went back to hospital, and my fabulous cancer care specialist nurse, Elaine, memorably said, "I must stop calling it whipping it out." And then she proceeded to whip it out in one breath-catching moment of surprise. However, it was a huge relief and a great lift in the quality of my life to be free of tubes. Unfortunately, and I think unusually, after a few hours, I began to go downhill as a urinary tract infection began to take hold. The little lurgy got in there and mucked around with me, and my temperature went up and down all over the place. But my GPs were fine. They gave me a course of antibiotics that held it, and then when that didn't really kill it, they gave me a second set, and that nailed it. And so after the best part of a second week, I returned back to me again and could start the third week in a really nice phase of really beginning to feel that in every way, every day, I was getting better and better as I convalesced properly. And so at the start of this fourth week, I've gone back to work, working mornings, and whilst I'm not there, I am so much better than I have been. And it's a real joie de vivre experience of, yes, isn't life wonderful? It certainly is. Now, that's kind of the process. There are side effects. You cannot have a major internal organ removed and everything rearranged down there because it's really crowded full of stuff without it having an impact. So the first and most obvious is some level of incontinence. I've had an obstruction blocking my ability to wee for, I don't know, probably 15 years or something. And suddenly that's removed and I can wee like a teenager now. But the controls aren't quite there. Now, part of the preparation for the operation is the encouragement to do pelvic floor exercises, which I did multiple times every single day. And part of the post-operative care is to carry on doing that. So the NHS Squeezy app is my friend. It reminds me repeatedly 5 times a day to do the exercises and then tracks through the exercises, and they do work. Incontinence can hit men in different levels of severity. I think mine is relatively mild. It's stress incontinence. When I cough, when I laugh, when I sneeze, when I hiccup, when I stand up, when I sit down, when I bend over, when I bend down, when I need to go to the loo, but something's delaying me and I've just got to the toilet and, you know, I'm sure we've all been there. But it's fine. The pelvic floor exercises are giving me greater and greater control all the time. And for any little leaks, well, you know, you have these things, these wonderful things that will protect your modesty. Protect your modesty and and come in various sorts. So this is like the big man bear version that I started using. Obviously, I know some of you be thinking, well, you know, I'm not really a giant bear of a man. I'm, you know, thinking my best friends Russ and Johnny Boy, who are like greyhounds. Well, guys, don't worry, because look, there's a slimline sports version for the agile mobile man around town. And you know, normally you kind of start with these, and then, you know, pretty quickly you end up with that, and then hopefully that all goes. As I say, I'm relatively light, and I feel like in a few weeks' time this will be sorted and it won't be an issue, and that's great. Next side effect is something no man ever wants to hear. I mean, I doubt many women would be like, "Oh, that's great news," but it's your penis is likely to get shorter. So your prostate sits just underneath your bladder, and through the middle of it goes your urethra, which is the pipe from your bladder to the outside world. And in order to remove your prostate, your surgeon, kindly has to remove some of the urethra that it surrounds. And then he has to pull up the urethra from below and attach it to the urethra coming down from the bladder and stitch them together in some microsurgical magic. This does mean there is a tendency for your penis to be lifted up into your body. Technically, it's not any shorter, it's just... And yeah, you could lose, you know, a few millimeters, half an inch, something like that. Not thrilling, I have to say. It's not like, you know, wow, that's a massive improvement. But I do comfort myself with the lifelong knowledge that I got the lucky end of the stick being a man. You know, women with breast cancer have to lose one or both of their breasts, or cervical cancer or ovarian cancer, all sorts of removals. Having your John Thomas slightly retracted seems like getting off lightly in comparison, particularly when the, you know, plan B is die of cancer. So not thrilling, but one of those things. Next up is a close friend, which is erectile dysfunction. So you've been mucked about, I've been mucked about surgically. My surgeon worked very hard to save the nerves that go from the prostate or that area to the penis, to ensure that I would be able to get erections again. Had my cancer been more extensively developed, I might have had to have lost those nerves. But for now, my penis is a little bit in shock. And so slowly, over the next few months, I'm expecting that to get better. And of course, we are blessed in an era of both erectile dysfunction drugs being widely available, and they can be prescribed, and they'll be prescribed for me, and also for you know, things like pumps, which sound more fun than they might have sounded before the operation, because I was reassured that actually getting an erection is a really important thing for the health of your penis. It's not just you being a sex pest. No, it's actually healthy. So that's good to know. Next up, when my sexual function really begins to blossom again, I need to get adjusted to the fact that I'm not going to be firing any more bullets. You know, as a young man, my DNA went zooming around all over the place. In my 40s, I had a vasectomy, so I was firing blanks. and now I've had my prostate removed, and I'm not going to be firing anything at all. Again, it's a bit of a shame. Saves on tissues, obviously. The main point is, just because you're not firing any bullets doesn't mean that you don't fire the trigger. Sorry if this is a bit metaphorical. So you can still come, just nothing happens from a male perspective. But, you know, again, going back to women seem to be pretty amused with life when their trigger is pulled and, you know, nothing fires out. So that all seems to be something very much to look forward to. Next up for me is that I need to keep an eye on this. There is a chance of the prostate cancer returning. It's a low one, and it's an easy to detect one if you have yourself checked, as I will be every 6 months for the next few years. And there's a slightly elevated risk that I could get a second cancer unrelated to my now missing prostate. And I will have to fight the good fight on that. I don't like the sort of surviving cancer thing, at least for me. I mean, for some people, their battle with cancer is epic and life and death. I feel my fight as being so small that I can't claim realistically to be any kind of survivor. But, you know, I will have to eat healthily. I will have to maintain a good weight. I will need to keep a vegetable high diet going. I will need to only drink in moderation, which I kind of did anyway, but so it's not a great hardship. But I need to keep my eye on the ball, because cancer is a sneaky, sneaky bastard of an illness, and it loves to come back when you're not looking. Now, with all that, the good news is that my results have come back from the pathology lab. They salami sliced up my prostate into tiny wafer-thin slices and had a good look through. And they found that the cancer cells were all caught in an area, and there was a very clear margin around it, which was not cancerous, which is exactly what they want to hear in terms of massively lowering the risk that the cancer might have spread anywhere else. So, who bloody Ray? I can breathe a giant sigh of relief, knowing that I've done everything I possibly can, supported by my lovely partner Amy and the great medical staff, to give me the very best chance to live a continued long and healthy life, as long as I play my active part in that. And that's really what I wanted to explore with you. It is life-changing, but life is good. I mean, life is really good. And none of those changes, none of those side effects that I've discussed in any way diminish the fact that life is a wonderful, wonderful thing to have. So please, enjoy yours. Thank you for watching.